Hi everyone, my name is Dr. Ellen Burbrink, and I wanted to take a little bit of time to talk about canine vaccinations. We're seeing a lot of new puppies, which is absolutely fantastic. We love seeing all the new fur babies coming into the clinic. We're just as excited about puppies as you guys are. But that also brings up a lot of questions about canine vaccinations and why are we vaccinating every 3 weeks in puppies, and why are we doing some at 1 year and some get boosted at 3 years, and what do these vaccines actually protect against? I think a lot of us know, hey, my dog needs a distemper, but why and what is distemper? So I want to just take a little bit of time to discuss vaccines and what we're actually protecting against. So first, what is a vaccine? And not to get too technical on everybody, but it's basically a substance used to stimulate production of antibodies in our dogs and help provide immunity. And it can be against one, or in the case of our distemper vaccine, which is actually 4 different sort of vaccines in one, you can protect against several diseases. It's typically prepared from the actual causative agent of the disease, whether it's a virus or bacteria, or it could be a synthetic substitute. And it's treated to act as the virus or the bacteria does, but without actually causing the disease. So there's a little diagram down there in the bottom left of what an antibody looks like, sort of this Y-shaped structure. And when it comes in contact with what we call the antigen, which is your virus or bacteria, should be like a little puzzle piece. So it's got to fit just correctly in order to kill off the bacteria and the virus. And what the vaccine does is it kind of preloads this antibody. So it prepares it, puts it in the right shape that it needs to be, so that when it contacts these antigens in real life, which is again the virus or the bacteria, it's ready to go and kill these things before they cause disease in our pets. There's kind of 2 different types of vaccines that we use, and they will be words that you may see on the vaccine labels. They kind of determine why we need to booster some at certain times and whether or not they're going to have reactions and things like that. So it is kind of important to understand the difference between these 2 different categories of vaccines. The first one is called a non-infectious vaccine. This one does not infect the host cells. They typically contain something called adjuvants, which are different sorts of chemicals to kind of stimulate the immune response. They also contain chemicals that have killed or inactivated the bacteria, which is why that they don't cause any disease in our pets. So again, these are called inactivated, killed. You'll hear the word recombinant, or in the case of snake vaccines, avenomous, because clearly we don't want to inject any type of venom into our animal. This is your rabies vaccine. This is also your canine influenza, your Lyme, leptospirosis, again, that rattlesnake vaccine, which luckily we don't have to use very much here. And then sometimes some of your Bordetella vaccines, depending on which Bordetella that you're giving at the time. There is pros and cons to all of our vaccines, but this non-infectious vaccine has quite a few pros. It's very stable because it doesn't need to be viable. Again, we put chemicals in there to kill or inactivate the bacteria, so it's a very stable vaccine. So we think these are safer because obviously they can't cause disease. The other good bonus on this one is if they've been previously vaccinated and you do a booster vaccine that's performed on time, is you're going to get protection within hours to days, which is why we really like you to bring in your pets on time for their boosters. So if they're coming in for their canine flu and they're right on time, when we give that booster canine flu, they're really just going to continue the protection that they already have, so there won't be any lapse. The cons, though, because of those additional adjuvants and chemicals that are in them, we can get hypersensitivity or allergic reactions. So these ones are a little bit more common in these vaccines. So sometimes we'll have to pre-medicate with Benadryl or separate out vaccines to make sure that your puppy doesn't have any reactions. They do require 2 doses to be effective. So that's where we'll say we're going to do your initial vaccine and then we need to booster it 3 weeks later. The exception to this is rabies. Rabies is once you do the 1 vaccine, it's good for a year the first time you give it. The other con of these types of vaccines is the duration of immunity is usually shorter. They're going to require annual boosters. So that immunity just doesn't hold as long as the other type of vaccines. Again, exception to this is rabies. After they get that 1 year rabies, when they come back again, rabies will be good for 3 years after that. Also, if you're really overdue, you forgot to come in for that lepto for 2-3 years in a row, we really should start the series over again. So again, doing that first dose and repeating it 3 weeks later to make sure we maintain good immunity. The other type of vaccines are what we call our infectious vaccines. These ones have been like genetically modified. So again, they're unlikely to cause any disease, and they must infect the host cells in order to develop immunization or proper immunization. The immunity is going to occur really quickly, so within 4 to 7 days after the vaccine. And these ones we don't have to redose as often, which is kind of nice. Words you'll hear about these ones are attenuated, modified live, viral vectors. This is your distemper vaccine, which usually also includes your parvovirus, adenovirus, and then some of your Bordetella vaccines. The Bordetellas don't usually last 3 years, but they are included in this category. So again, kind of the pros of this one, there's a lot of pros. They're more effective because they do provide the same immunity as natural exposure, because again, they infect the host cells, so you get really good immunity with using these ones. The one single dose is going to prime, immunize, boost all at the same time. The only sort of exception to this is in our young puppies, and that's because their maternal antibodies that are in their system from mama, they actually interfere with the ability to form good immunity. They kind of fight our vaccines a little bit. So we've got to redose these guys every 3 weeks until they're that 14 to 16 weeks of age. Even if they're overdue, so we have a dog that hasn't had a distemper since it's 2 years old, and it's now coming in at 8 or 9 years old, I don't have to do 2 vaccines to get that distemper to last a year. So a single booster is really sufficient, and it'll protect them again. And the duration of immunity can be pretty long in these guys, which is really nice. Not many cons to these vaccines. We do have to mix them up when we make them, but that's our issue, not yours. So they come as a powder and a liquid, and you just got to mix them together, but you do have to use them within an hour once they're mixed. A lot of people ask me about titers, which I think titers are awesome. We can do titers for distemper, parvovirus, and adenovirus, again, those infectious type vaccines. What a titer is that you draw blood on your pet and send it off, and they'll give me a positive or negative whether or not they have antibodies in their system. And if it comes back as positive, then it's a really good correlation between yes, the vaccine worked, and yes, they are protected against disease. So we don't actually need to revaccinate them at that time. The negatives for the titers are they are very expensive, and you really need to do them annually. So that way we can find exactly the time frame when, you know what, it's not good anymore, they're not protected, and we need to go ahead and revaccinate them again. Rabies titers are typically used when patients travel, but they can't be used in place of revaccination. This is just by state and federal law. Regardless of how high the titer levels are, they just don't say that it correlates with protection, and that's because the rabies virus is obviously so deadly. Other diseases, so again, those vaccines, those non-infectious vaccine diseases, the lepto, Lyme, CIV, Bordetella, titers really just don't have any value. The antibodies only are persisting for a short time, and there's not really any correlation between titer level and level of protection. You'll also hear us talk about core vaccines versus non-core vaccines. The core vaccines, which is your distemper, the adenovirus, parvovirus, so again, that distemper combo virus, and rabies are our core vaccines. They should be given to all dogs, all ages, and that's because these diseases have a very high morbidity and mortality rate. They're literally found everywhere. They can be quite bad for the dog, and we already know that vaccination results in really good protection. So we consider these core, that really all pets should have them. The non-core vaccines, I use the term optional very loosely because depending on where your pet lives or its lifestyle, some of these may not really be optional, but that's definitely a discussion that you want to have with your veterinarian to determine if they are exposed to these diseases and whether or not they should be vaccinated. Things like lepto, Lyme, parainfluenza, Bordetella, CIV, all those things are really based on the lifestyle of your pet. So now what I'm going to do is kind of go over each one of these diseases and why we vaccinate with them, what they look like in your pet, and why it's so important to keep them up to date on their vaccines. Again, everybody's pretty familiar with their pet coming in and needing the distemper vaccine. Our distemper vaccine is actually protecting against 4 different diseases: distemper, adenovirus, parainfluenza, and parvovirus all in one. We call it the distemper because that's the first disease it protects against, and that's just kind of how the name started. But distemper virus, luckily, we don't see a whole lot of this anymore because I think we're doing a really good job with vaccination. But essentially, it's transmitted with the respiratory secretions like your coughing dog, but it can really be shed in pretty much any body secretions. Infected dogs will usually shed the first 2 weeks of their infection, and typically kind of the pathology of the disease is that within 24 hours after contacting this virus, it'll spread through the local lymphatics. Within 6 days, it's in the abdominal organs, the spleen, the liver, small intestine, and stomach. By day 9, it's gone into the central nervous system. And by day 14, if you have an animal whose immune system is not fighting this off, like a young, unvaccinated animal, then it's going to enter the epithelial cells. And the symptoms just correspond with where it is in the disease process. So you'll start with respiratory signs like coughing, and then it goes on to the GI signs of vomiting, diarrhea, and then finally the central nervous signs, which are like seizures and tremors and weakness. One of the big characteristic features of distemper is sort of this callousing of the nose and also of the foot pad. So this picture here on the bottom right shows a very poor little puppy who has tons and tons of nasal discharge, but that thick callousing is very characteristic of distemper. It's very challenging to diagnose this disease. It's very elusive. A lot of times we don't officially diagnose it, unfortunately, until you have post-mortem tissue samples. This is a virus, so really treatment is just supportive care. You'll treat bacterial infections that are secondary, but you're just trying to get these poor little puppies through this. Prevention is just vaccination. So we do start puppies at 6 to 8 weeks of age, continuing every 3 weeks until they're 16 weeks old. You'll booster it at a year, and then this is one of the ones that you just booster every 3 years. If they happen to get this as a puppy and actually survive, they are technically immune for life, which is a good thing, but these guys oftentimes don't make it that far. Parvovirus is definitely one I know a lot of people have heard of. We still see this from time to time. It's a pretty devastating disease on some of these little puppies. It's a virus that's shed in the feces of infected dogs. So usually puppies get it from licking feces off the ground, or areas where the virus has been, like blankets or bowls or things like that. And essentially, once it gets into their mouth, it gains access to the lymphatic system in the bloodstream, and it loves to go after rapidly dividing cells, your small intestines, your lymphatics, and the bone marrow. Usually they'll start signs about a week after they get exposed. They have really high fevers, they're super lethargic, they're not wanting to eat, and the classic sign of this is just really nasty bloody diarrhea. If you've ever smelled a parvo dog, it's a smell that you'll never forget for the rest of your life. You can almost diagnose these guys based on the smell. It's like a tin metal type smell, and it almost smells like their entire GI tract is just sloughing. So luckily, we do have some pretty good diagnostics for this. There's just an in-house test that we use on the feces that's typically pretty accurate. Occasionally get some false positive, false negatives. Treatment for these guys, they require pretty aggressive hospitalization. They have to be in isolation because this virus is extremely contagious. It's also extremely hardy. It'll last in the environment for months. So you have to be real careful as far as your sanitation procedures with these. This gets really expensive very, very quickly because these guys are so sick and need such intensive care. Prevention is, again, vaccination. And it's a similar protocol as it is with the distemper because it's with the distemper vaccine. Rabies virus, we do see a couple of rabies cases every now and then. I did work with a wildlife rehabilitator who specialized mostly in raccoons and had to euthanize a couple of raccoons for rabies. So it's definitely found in Virginia. I think most people are familiar kind of with rabies transmission. It's a bite from an infected animal. The saliva is where the virus likes to hang out. Once an animal gets bit, it'll kind of replicate in the muscle, then work its way up the central nervous system to the brain where it can cause encephalitis, and then move into the salivary glands and try to repeat the cycle again. The symptoms can take a kind of big range of time before they can show up, anywhere from 21 to 80 days. Some of these animals have to be quarantined for 6 months sometimes to make sure that they're not showing symptoms. And that's because it all depends on kind of where the bite was, if it was close to a blood vessel, how much virus was in the saliva at the time of the bite. So there's just a lot of things that go into how quickly they'll show symptoms. Kind of two forms. I think most people are familiar with kind of furious rabies versus paralytic. So furious is where you have those behavior changes, aggression, nervousness, irritability, and then it can progress to the paralytic form, which is like seizures and paralysis. Diagnosis, really the only way to diagnose this is getting brain tissue on these guys. And you just kind of, based on the history and their signs, kind of rule out what this is. There really isn't treatment for this. So that's why if an unvaccinated pet is bitten by a rabid animal, the recommendation is going to be to euthanize immediately. If you have a vaccinated pet, but is overdue for their rabies vaccine, then you're looking at quarantines from anywhere from 10 to 45 days. There's very specific protocols that are in place that we have to follow if your animal is bitten or if you're bitten, as far as quarantine and things like that. Again, vaccination is required by state law. All puppies starting at 14 to 16 weeks of age have to be vaccinated. That vaccine at 14 to 16 weeks of age is good for 1 year. And then when they come back at that year, their vaccine will be good for every 3 years after that. Adenovirus, again, this is one that's included in the distemper kind of combo, as you can see on the bottom right there. It actually has 2 strains. It's also transmitted via respiratory, but can also be transmitted with contaminated feces or urine. These infected dogs can shed for a long time, about 6 months. And this is another one that's pretty hardy in the environment. It can last for a while. There's 2 strains. The first one causes inflammation of the liver or hepatitis, and can result in kidney issues and can cause something called blue eye. So if you look at that dog on the bottom left there, he has the kind of the classic blue eye. And then the second strain, CAV2, causes respiratory disease. So it is part of our respiratory syndrome that we'll talk about in a few minutes. The symptoms are going to be depending on which strain they get. So if they have the liver one, it's going to be fever, vomiting, diarrhea, and of course respiratory one, you're going to have that dry, hacky cough, and sometimes eye infections. Diagnosis, again, very tricky to get a definitive diagnosis on these guys. It's a virus, so treatment is just symptomatic and supportive. The interesting thing about the vaccine, though, is if you look at the label, it says adenovirus type 2. Because what they found is that you only need to use the second strain as part of your vaccine series, and it'll actually cross-protect against both strains. When they tried to use the CAV1, it actually caused dogs to get blue eye and also to shed some of the virus in their urine, which is less than ideal. So they just used the adenovirus type 2 in the vaccine development. Leptospirosis is something that we do see in this area. It is caused by direct contact with infected water or infected urine. This frequently lives in wild animal urine, and again, they pee everywhere. So your dog would get this by drinking contaminated water or eating infected tissues from a dead animal. It is very important because it's what we call zoonotic, which means that your pet can give it to you. What happens with this bacteria is once they ingest it, it'll spread to the lymphatics, and it preferentially goes to the liver and the kidney, and then it can be shed in the urine. So if you expose yourself to an infected dog's urine, then it's something that you can potentially pick up. It's a cool looking bacteria, as in the picture on the far left. It's sort of a circular corkscrew type bacteria, and there are 17 different species of this guy. So there's a lot of different what we call serovars. The symptoms are going to be related to where it's at in the system of the dog. So if you got the liver signs, again, vomiting, diarrhea, they can be yellow or jaundiced. The kidney signs are going to be excessive drinking and peeing. a lot of these guys will come to me in complete kidney failure, and they can be very, very difficult to pull them out of this. This is a pretty aggressive bacteria. There are in-house tests available for this, which is great. We can also send blood out and test for this, so we can diagnose this much easier than some of the other diseases. Treatment, because this is a bacteria, at least we've got antibiotics, and it's usually penicillin and doxycycline is what we use, but it's for a pretty extended period of time. Vaccination, very key. The vaccine that we have protects against the 4 most common serovars that are in this area. And again, this is one of those vaccines that you do the initial one, have to booster it 3 weeks later, and then you have to do an annual vaccine to keep them up to date. All right, just kind of 2 more different groups of vaccines. The first one is Lyme. It's one of my absolute favorite vaccines to talk about. I'll actually do a whole separate talk just on Lyme because there's a newer vaccine out that is really incredible and has kind of been a game changer with helping us protect our animals against Lyme disease. Lyme's transmitted by ticks. I think most of us are familiar with this. It's transmitted by the ixodes or deer tick. It's found very, very heavily on the eastern United States. Virginia is heavily endemic for it. The tick usually bites your pet, has to stay attached for about 24 hours, and it'll transmit the bacteria into your dog. A lot of our dogs don't show any signs, but if they do, the vast majority of them will show joint pain, muscle pain. They often run fevers. Some of these guys will come into me literally not walking because they're so painful. In a few cases, it can go to kidneys and cause something called Lyme nephritis. This is extremely poor prognosis, and I have unfortunately lost 3 or 4 pets to Lyme nephritis. It's the kidneys just can't take it, and they'll go into failure, and it's almost impossible to pull these guys out. And it's really devastating because they tend to be very young dogs. A lot of times the signs won't occur until 2 to 5 months after a tick bite, so you may pull off a tick and think, okay, everything's good, and then your pet will have symptoms a long time later. We do test for Lyme every single year. So when you bring your pet in for that heartworm test, we are screening them for all the tick-borne diseases, including Lyme. If we're still not quite sure if that's a previous infection, you can run a separate test called a C6 quantitative test, and that'll let us know if they have an active infection going on. The good news is there's really great treatment. Doxycycline 28 days works extremely well against this bacteria. Prevention, there's a bunch of things we can do. So your monthly flea and tick preventatives, obviously pulling your tick off right away. And then again, there's this kind of new Lyme vaccine called chimeric recombinant vaccine that is absolutely amazing, but it does a really, really good job at helping protect our pets against Lyme. This is again one that you give the initial, booster it 3 weeks later, and then it does need to be an annual. All right, and finally we're going to talk about the canine infectious tracheobronchitis, or what we call kennel cough. Kennel cough's a very loose term because a lot of people think, oh, they associate kennel cough with just the Bordetella vaccine. But the truth of the matter is that there's usually numerous organisms involved in this. Bordetella is definitely one of them as a bacteria, but there's also viruses like parainfluenza. Adenovirus we talked about can have a respiratory component. Distemper can. There's canine flu, herpes virus in young puppies, mycoplasma. I say coronavirus, but please know I'm talking about a completely different strain of coronavirus than the one that's going on right now. So this is very, very different. A lot of owners will call me and say, I think my dog has something stuck in his throat. So that's the most common sort of presentation that we have, is a dry hacking type cough. Sometimes they actually come in for vomiting because they're coughing so much that they're hacking up bile. So owners bring them in for vomiting, not realizing that it's actually a respiratory problem. These are very well shed in the respiratory secretion. So again, coughing. Incubation is about 2 to 14 days. So if you have a pet that went to doggy daycare or doggy boarding and got exposed to any of these viruses or bacteria, they will typically show signs, on average, I would say about a week later. They're usually sick for about 1 to 2 weeks, but if they don't get treated, then they can actually shed the bacteria or the virus for about 2 to 3 months. But if we get aggressive, which is why I usually always put any of my coughing dogs on some type of antibiotics, then the shedding is much less. So again, we're going to protect all the animals around them. What's interesting about this group is that they damage something called the mucociliary escalator, which is an important kind of anatomical feature of the respiratory tract. It has all these sort of ciliary bodies throughout the whole respiratory tract that have a mucus layer. This mucus layer on top actually will trap the bacteria and virus, and then the cilia will actually move them towards the throat where they can be swallowed. So that way they're not getting into the lung tissue. And essentially these viruses and bacteria do a lot of damage to this mucociliary escalator. The escalator can also be damaged by stress, lots of heavy dust, cigarette smoke, cold temperatures. So some of these dogs can already be more predisposed to a worse infection if they already have damage to the mucociliary escalator. Diagnosis, there is a really nice PCR panel that you can send to Cornell to look for a bunch of these diseases. The problem is a couple-fold with this. Number one, it can take 2 to 3 weeks to get results, and by then your pet's already over this a lot of time. It is pretty expensive. It's about $275 for this panel. It's much cheaper just to put them on antibiotics or even do chest films. Also, to get the right samples, you have to do a sample of their conjunctiva or kind of their eyelid area, which is not a big deal. Nasal passages, they'll tolerate that. But trying to get a deep throat swab on a dog is pretty much impossible. So I've not really been successful with that. So sometimes I feel like I'm getting false negatives on these because I'm not able to get good swabs. Again, antibiotics, I usually always put these guys on to cover for the bacterial component. The viral component just has to run its course, and you just use supportive care with cough suppressants. I love steamy bathrooms, teaspoons of honey twice a day to help calm the throat, just anything to just kind of help give them a little bit of symptomatic care. Talking about Bordetella specifically, it just has a couple of really cool features that make this a very, very tricky little bacteria. This guy actually will bind directly to the cilia, so they actually can't move, which is interesting. So that way it's allowing it to get further down into the respiratory tract. It's also able to disable the immune cells that are responsible for destroying it, which is also an interesting feature of this bacteria. We clearly have a Bordetella vaccine. Most of you guys probably have your dogs vaccinated against this. What's nice is the nasal or oral one. We usually use the oral one where you'll see us put drops in their mouth. Only takes about 4 days to generate a really good immune response after it's given. If we need to give the injectable, still only about 1 to 2 weeks, and you'll generate a very, very good response. I always warn my pet owners that even though your pet is vaccinated against Bordetella, it's not going to prevent the infection 100%. What it's going to do is try to minimize the symptoms and hopefully not allow that bacteria to gain further access into the respiratory tract. Parainfluenza, we're just kind of glance over this. It's just part of, again, that DHPP vaccine. It's part of the infectious tracheobronchitis group. Again, it's just another one of those respiratory bugs, and just treat symptomatic and supportive. Canine flu has definitely made a bit of a big surgence over the past couple of years. There's actually 2 strains. The first one, the H3N8, was identified back in 2004 in Florida. It's actually an equine flu bug that jumped species into the greyhounds, the racing greyhounds, because they were all in the same track together, and then kind of spread its way through a lot of other dogs. And then H3N2 was identified in 2015 in Chicago, and it was originally an avian flu strand that again jumped species into our dogs. Initially there was kind of like hot button areas, but now it's pretty much everywhere. It's spread itself very nicely throughout the United States. It's an aerosol transmission, but also be careful with dogs that cough on bowls or blankets. Certainly dogs can get exposed that way. It can stay viable on those surfaces for about 2 days, on your clothing for about a day, and on your hand for about 12 hours. They'll shed the H3N8, which is the equine one, for about 10 days. And then the avian one, it can be a little bit longer shed, up to about 24 days. Really, really important part of this virus is that shedding actually often occurs before the onset of clinical signs. So you have an asymptomatic dog is just standing there looking fine and can be shedding virus. And then they'll start coughing a couple of days later. Also important to note, this is not contagious to people. So this is a dog-only virus right now. It affects the respiratory tract, so again, sneezing, coughing, and can predispose them to those secondary bacterial infections. They'll start coughing about 2 to 4 days after the infection. Most of them have just a mild form, but they can cough for a while, about 10 to 30 days. Sometimes they'll get a fever. Again, if you have secondary bacteria, you can get a nasal discharge. The severe form is pretty uncommon, where they get a really high fever, pneumonia. Even some of the greyhounds down in Florida had something called hemorrhagic pneumonia, where they'd be coughing up blood, but that's pretty uncommon. Fatality rate's really low with this. Usually we don't need to treat it, but the problem is that canine flu looks exactly like every other respiratory bug. So I cannot tell you if your coughing dog has canine flu versus Bordetella versus anything else without doing that PCR panel. So again, we probably quote unquote treat flu with antibiotics. And again, we're just covering for secondary bacterial infections, but it's got to just run its course. Vaccination, obviously we have a really good vaccine that protects against both strains. It is also one that you have to do an initial dose, booster it 3 weeks later, and then annually. And I definitely recommend the flu vaccine for any dogs that are going to be around other dogs, just like any of these respiratory pathogens. So if your dog is prone to playing with other dogs, being around other dogs, then they really should be protected against this. And kind of in summary, what's the common theme with all of these diseases that we talked about is that vaccination is key. We've made so much progress over the past several decades with science and medicine, understanding these diseases and being able to develop vaccines that really protect our sweet babies. So when you have a cute little puppy like this one coming into me, this is why I vaccinate. I've seen dogs suffer through diseases that they don't need to if we just vaccinate them. So I'm a big believer in it. And hopefully this answers some more of your questions about why we recommend them. But if you have any other questions, please feel free to let us know. We're always here to help you guys.